Now the next thing that we will be studying is about the immune tolerance. Okay, so what is this immune tolerance? Immune tolerance is basically a state of unresponsiveness or suppression of the immune response. It is the state of unresponsiveness or the suppression of the immune response. See, I'll give you an example. When on a fine day, you and your brother had a very major fight. So what your brother decides is, your brother decides not to talk to you. Okay, so he goes in a state of unresponsiveness. Whatever you will ask him, he will not give any response, right? Similarly, our immune system also undergoes the same mechanism, right? This is the universal thing that you all say, right? So it undergoes to any specific antigen and particularly the self-antigen. Just like your brother, he will talk to everyone around you, but he will not talk to you. Okay, but after sometimes he will start talking to you, so don't worry. After 2 to 3 days, everything will be fine. So the types that you have is the central one and the peripheral one. In the central one, what will happen? In the central one, you need to remember about the T cells and the B cells. So the T cells, the lymphocytes develops in the thymus, and in the B cells, the lymphocyte develops in the bone marrow, B for B, right? The mechanism that you have, the immature lymphocytes. The immature lymphocytes is your brother. See, no offense, I'm just trying to explain you with the help of one story. Actually, I also have a brother, so that's why I'm just giving his example. So you have an immature lymphocyte, that is your brother, that recognizes the self-antigen, that is you. It recognizes you, and which have a high affinity, they are eliminated and inactivated. He decides not to talk to you. First he fights, and then he decides to not to talk to you. Similarly, this immune system, there is an immature lymphocytes. They recognizes the self-antigen. Wait, I'll highlight. Immature lymphocytes recognizes the self-antigen, then which have the high affinity and are eliminated or gets inactivated, right? Look at this figure. You have the central tolerance of the thymus or the bone marrow. You have the immature B cells or the T cells. The process of apoptosis of cells is there. They recognize the self-antigens. And there is mature B or T cells that will take part in the peripheral tolerance, right? We'll discuss about the peripheral tolerance as well. First, just finish this. The immature lymphocytes recognize the self-antigens which have the higher affinity and are eliminated. So, the mechanism in T cell and B cells will occur simultaneously. In the T cells, you have the positive selection and the negative selection. Positive selection basically ensures the T cells to recognize the self-antigen of the MHC molecule, The negative one eliminates the T cells that binds to they basically eliminates the T cells that bind strongly to the self-antigen, right? Next that you have is the B cells. So B cells, they have the self-reactive B cells. They undergo the clonal deletion, receptor editing, and the anergy, that is the functional inactivation. So they undergo the three mechanisms. Okay, what is the clinical relevance? If there is any failure to the central tolerance, this will lead to the severe autoimmune disorders. And after completing this, we will understand about the autoimmune disorders as well. Next that you have is the peripheral tolerance. Peripheral tolerance occurs outside the primary lymphoid organs in the periphery. It occurs outside the periphery, right? Because the name is also suggesting periphery. This means the mechanism is taking place over the periphery, and the central one is the mechanism is taking in the central place, right? It's very simple. The mechanism, first thing you have is the anergy. The lymphocytes are basically rendered non-functional when they recognize, okay? Then there is suppression. The regulatory T cells actively inhibit the immune response. The T cells, okay? Immune response, the T cells basically inhibit the immune response. Then there is clonal deletion. As a result of which the self-reactive cells undergoes the process of apoptosis. And apoptosis uses which CD ligand? It uses the CD95. Okay. Next that you have is about the immune privilege. See, there are certain tissues like the eye, brain, and the testes. They prevent the immune attack by isolating themselves. just like your mother. Although your mother may come in between the fights, but let's say just like your father, he always try to escape from the fight, right? So this immune privilege is about your father. That is, there are certain tissues, that is like our eyes, our brain and the testes, they isolate themselves from this immune attack, right? So remember your father. That's it. Next that you have is the importance of immune tolerance. Why is it important? Why we are studying about the immune tolerance? First one is, it prevents the autoimmune diseases like the type 1 diabetes, rheumatoid arthritis and the systemic lupus erythematosus. And if we are talking about diabetes, such a very important topic, diabetes, let's talk about the criteria. Let's talk about the criteria. The criteria of diabetes, remember 200 and 126. What is 200? 200 is basically your random blood sugar. What is 126? 126 is your fasting blood sugar. And one more thing is your HbA1c should be more than equal to 6.5, right? So, see, diabetes is such an important topic now. See, if it is not at all an important topic also, then also you have to understand about diabetes, because it is very, very much important in India, okay? Next thing that you have, it is essential for fetal development during the pregnancy, plays a role in the organ transplantation, and it prevents the chronic inflammation. That is inflammation which occurs, which is not suppressing for more than 6 weeks, right? Then you have the clinical application. In the clinical application, what you need to remember is about the autoimmune disease management. See, understanding the tolerance will help in designing the immunosuppressant therapy. If we are not able to understand the mechanism, that what is going on, we are not able to give a proper treatment to the patient, and the patient will not recover. So it is very, very much important. The immune tolerance is so much important, that what is happening in the body and why the body is not accepting that medicine. It's very, very important to understand and plan a treatment for the patient, right? Next that you have is the organ transplantation. Inducing the tolerance can prevent rejection, right? We can prevent the patient from the transplant rejections if we do this process seriously, right? Next that you have is the cancer. The tumors basically exploit the tolerance mechanism to invade the immune response. There are checkpoint inhibitors. They restore the immune activity. Okay. At last, you have a summary table. What is in the summary table that we have? We have that you need to remember that it prevents the immune system from attacking the self-antigen. It prevents the immune system from attacking the self-antigen. Then you have the two types, central and the peripheral. In the central, you have the thymus and bone marrow, and in the peripheral, you have the outside organs. And the failure leads to the autoimmune disease. And I also remember that we forgot to discuss about the peripheral one mechanism, right? In the peripheral one, you have the secondary lymphoid tissues, as a result of which you have the interaction of the B cells and the T cells on the antigen presenting cells. Both comes to the antigen presenting cells. Then you have the T regulatory cells, B cells and the energy, as a result of which at last there will be activation induced cell death. At last there will be activation induced cell death that will be there. Okay, so this is not very important, I can say, from your university exam point of view. It can be asked as an MCQ, so read it from that perspective only. Okay, next we are done with this, and now it's time for us to solve some MCQs. First MCQ. First MCQ is, immune tolerance prevents the immune system from attacking the self-antigen, right? Next is, where does central tolerance occurs in the T cells? T for T, it occurs in the thymus. Third one you have, although the answers are written over here only. Anyway, third one, which of the following cells suppresses the immune response in the peripheral tolerance? In the peripheral tolerance, that are your regulatory T cells. Okay, so we are done with the immune tolerance part as well. Okay.